Reproductive Technology, Pre-Implementation Genetic Testing, PGT, by Alyssa Alvarado and Ezzy Del Palacio. Just to overview, there are 3 different types of PGT testing. There's PGT-M, PGT-A, and PGT-SR. Throughout this video, we will be thoroughly explaining the risks and advantages, the testing process, and also the costs associated with PGT testing. Each test provides a specific goal in terms of embryo analysis and evaluation. To begin, in vitro fertilization is a genetic testing method essential to PGT results. In vitro fertilization involves a process of fertilization to where an egg is combined with sperm in vitro. The process involves monitoring a woman's ovulatory process, removing an egg from their ovaries, and requiring a man's sperm to fertilize them in a culture medium in a laboratory. Then, the fertilized embryo is placed into the uterus where the baby develops. In IVF, the embryo cells are sent into a laboratory for evaluation for any chromosomal abnormalities, and thus the PGT process occurs. The first PGT testing type is pre-implementation genetic testing for monogenic disorders, which is PGT-M. The testing process involves testing the embryos in a genetic lab to analyze the cells to determine if the cells hold a single gene disease. In single gene diseases, a mutation in just one gene is responsible for disease. Single gene diseases run in families and can be dominant or recessive, and autosomal or sex-linked. PGT-M tests for things such as Huntington's disease, sickle cell anemia, and cystic fibrosis. Of course, PGT-M holds risks and advantages. Some risks are similar to IVF, which could include lower rates of live birth, poor results leading to no successful transfer, and potential inaccuracy in results. Whereas some advantages could include lowering the risk of passing an inherited condition onto offspring. It can also aid identification and diagnosis of genetic abnormalities. As for costs, PGT-M typically adds $3,000 to $7,000 in the IVF process. In total, with IVF treatment, prices range from $17,000 to $25,000. Insurance companies are strict on insuring PGT. They don't cover the costs, making the procedure very costly. Another form of PGT is PGT-A, or pre-implementation genetic testing for aneuploidies. This is used to describe screening embryos for sporadic chromosomal abnormalities. The testing process involves testing embryos by counting the 46 chromosomes to look for extra or missing chromosomes. PGT-A testing typically looks for disorders such as Down syndrome and Turner syndrome. So PGT-A does come with risks and advantages, and while it doesn't risk the mother's health, it is known to carry some risks for the embryo. These tests are mostly accurate, however the test may give a wrong result by missing an abnormality or detecting that one is not there. However, some advantages could include improved embryo selection, optional gender selection, and prevention of transmission of unknown abnormalities. For costs, PGT-A ranges from $4,000 to $10,000 depending on the clinic and location, and similar to PGT-M, it's not covered by insurance. PGT-SR, or pre-implementation genetic testing for chromosome structural rearrangements, involves looking at the chromosome structure of the embryos and finding where segments have been deleted, duplicated, or inverted. It's used to reduce the risk of having a pregnancy or a child with an unbalanced structural abnormality, which involves extra or missing genetic material and typically results in pregnancy loss. This tests for abnormalities that can alter the health of the pregnancy, the mother, or even the child in the long run. Some risks could include parents who have chromosomal abnormalities. PGT-SR is appropriate for those parents who have these abnormalities, but they are then at risk for creating embryos with the incorrect chromosome number or structure. Some advantages could include improving the chance of a successful pregnancy following IVF and decreased risk of severe conditions in the baby. The cost of PGT-SR can range from $5,000 to $7,000 or more per cycle, including the specialized testing techniques required to identify specific structural abnormalities. As for all PGT testing methods, PGT-SR is not typically covered by insurance. People who might want to consider PGT are women of age 37 and up, and couples with a higher risk of affecting a child with a genetic disease, or even reoccurring miscarriages for the reason of chromosomal abnormalities. With a lot of medical practices, PGT does not come without controversies. Accuracy concerns, religious concerns, and high costs due to insurance not covering it are all controversies that surround PGT. Overall, it is safe to say that it is the partner's decision to determine their course of action and to seek potential help